Welcome to the Affirming Minds Podcast, where we equip like-minded mental health professionals with a therapeutic toolkit that helps add to a more engaging, fulfilled, and effective mental health practice. Each empowering episode can stand alone as a continuing education pod course or a very valuable professional or personal resource with insightful expert interviews, practical resources, industry news, and lots of inspiration. We help the modern therapist thrive at work. Now let's welcome your host, a dedicated therapist and passionate educator, Shaina Siber, LCSW.
Welcome to the Affirming Minds Podcast. I'm your host, Shaina Siber. Today's episode is eligible for continuing education credit. To earn credit, visit affirmmentalhealth.com and join our membership, where you'll get CE access for our podcast episodes, plus workshops, self-study courses, and so much more. If you're already an AFFIRM Academy member, simply log in through the portal or use the link in the show notes to access the post-test and evaluation. Once you complete it, your CE certificate will be emailed to you within minutes. If you enjoyed this episode, please take a moment to leave a 5-star review on Apple Podcasts or Spotify. It really helps other listeners find the show and join our affirming community of learners. A quick reminder before we begin, this podcast is for educational purposes only. If you're in need of mental health treatment or clinical supervision, please reach out to a licensed professional in your area. All cases and client stories described in this episode are de-identified, vignette-based, or composites, and no protected health information is ever shared. Hi, everyone. Welcome back to the Affirming Minds Podcast. Today's episode is a little bit different from our usual format. Normally, I'm the one asking the questions, but today we're flipping the script a bit. I'm really excited to share that I have a book coming out titled Using ACT and CFT for Burnout Recovery, the Beyond Burnout Blueprint. This book is the culmination of many years of clinical work with professionals navigating burnout and my attempt to bring together 2 frameworks that have profoundly shaped my thinking and practice: acceptance and commitment therapy and compassion-focused therapy. Before we dive in, it may be helpful to briefly introduce the 2 frameworks that shape much of this conversation: acceptance and commitment therapy, often referred to as ACT, and compassion-focused therapy, referenced as CFT. Acceptance and commitment therapy was developed by psychologist Stephen Hayes and colleagues in the 1980s and 90s as part of what is called the third wave of behavioral therapies. ACT is grounded in contextual behavioral science and focuses on helping people develop psychological flexibility, the capacity to stay present with difficult thoughts and emotions while continuing to move towards values and meaningful action. ACT has a strong research base and has been studied across a wide range of clinical and health contexts, including anxiety, depression, chronic pain, trauma, and occupational stress. Increasingly, ACT-based interventions are being used in workplace and healthcare settings to support professionals experiencing chronic stress and burnout. Compassion-focused therapy was developed by Paul Gilbert in the early 2000s and integrates insights from evolutionary psychology, neuroscience, and attachment theory. CFT was originally designed to help individuals who struggle with high levels of shame and self-criticism, particularly when traditional cognitive approaches were not sufficient. At its core, CFT focuses on cultivating the capacity for self-compassion and compassionate responding, helping individuals regulate threat-based emotional systems and develop more supportive internal relationships with themselves. Together, ACT and CFT offer complementary approaches. ACT helps individuals clarify values and take meaningful action in the presence of difficulty, while CFT directly addresses the shame, harsh self-criticism, and threat activation that often maintains burnout and chronic stress. If you're interested in learning more about these models, the very first episode I ever did of the Affirming Minds podcast includes a deeper introduction into both ACT and CFT, where I walk through the frameworks and clinical applications in greater detail. Many of the ideas we'll discuss today draw on the integration of these 2 models. Because the book explores these ideas in depth, I thought it might be interesting to step out of the interviewer's seat and have a conversation about the core concepts behind the work. Before we get into today's interview, which is with me, it may also be helpful to briefly clarify what I mean when I use the term burnout. In this conversation, we're not just talking about feeling tired or overwhelmed. We're talking about a pattern of chronic occupational stress that can show up as profound exhaustion, cognitive and emotional strain, and a growing sense of distance and disconnection from one's life and work. Today, I invited someone who knows this project very well, my dear friend and colleague, Dr. Laurie Gallo, who will be interviewing me about the ideas behind the book. Laurie also served as the developmental editor for this manuscript. If you're not familiar with that role, what it means is a developmental editor works closely with an author at the level of structure and ideas. So Dr. Gallo helped me sort of sharpen the arguments and help me clarify my thoughts to make sure the clinical concepts translated clearly for the readers, both clinician readers and people in non-clinical roles and professions who are burnout who may be finding this work. I so appreciate her insight, and she really made the book immeasurably better in so many ways. So let me tell you a little bit about Dr. Laurie Gallo. Laurie is a licensed clinical psychologist in the states of New York and Connecticut. She specializes in ACT with adults experiencing trauma-related stress, PTSD, anxiety, stress-related ailments, and depressive disorders. She is the founder of ACT or Thriving, where she provides individual therapy, supervision, and training. Dr. Gallo previously served as a lead psychologist and assistant professor at Montefiore Medical Center and Albert Einstein College of Medicine in the Bronx, where she held numerous clinical, supervisory, administrative, research, and leadership roles in the Department of Psychiatry and the pre-doctoral psychology training program. She is currently a clinical researcher and co-investigator on an NIH-funded study examining the effectiveness of ACT for comorbid chronic pain and opioid dependence among primary care patients receiving Suboxone treatment. Throughout her career, Dr. Gallo has focused on implementing trauma-informed and trauma specialty care in community mental health and hospital settings, and on adapting evidence-based psychotherapy to meet the needs of historically marginalized communities. In today's conversation, we talk about what burnout actually is beyond sort of the buzzwords, why traditional approaches often fall short, and how integrating ACT and compassion science can help clinicians support burnout recovery in a deeper and more sustainable way. We also explore the role of shame, over-control, systemic drivers of burnout, and why many high-achieving professionals are often the most vulnerable to it. This is really a passion of mine. I could talk about it all day. I really hope you enjoy our conversation. And if you'd like to explore these ideas in more depth, and I go into so much more depth, please check out my book, Using ACT and CFT for Burnout Recovery, the Beyond Burnout Blueprint. The book will be available March 18th, 2026, wherever you get your books. So with that, I'm going to step out of the host chair and I'm going to hand it over to Dr. Laurie Gallo. Let's get into it.
Hi, everyone. Welcome to the Affirming Minds podcast. My name is Dr. Laurie Gallo, and I am going to be guiding us through a conversation with Shaina Siber, the owner and founder of AFFIRM Mental Health, who we are lucky to have here today to be in the other seat and share with us some really amazing work that she's done. So Shaina Siber, LCSW, is an integrative therapist, educator, and the founder of AFFIRM Mental Health, which is an accredited continuing education provider for licensed clinicians. She is the host of the Affirming Minds podcast, a CE-eligible podcast for therapists. She has over 15 years of experience in clinical and leadership roles across community mental health and hospital-based healthcare settings. And she maintains a private practice where she works primarily with healthcare professionals, working parents, and others in high-demand professional roles who are navigating burnout, trauma histories, systemic stress, and co-occurring mental health concerns. She has a new book coming out entitled Using ACT and CFT for Burnout Recovery, the Beyond Burnout Blueprint, published by Routledge. I'm happy I've had the joy of reading this book. This book presents an integrative, evidence-informed framework for treating professional burnout. It draws upon acceptance and commitment therapy and compassion-focused therapy, and it offers clinicians a structured 6-step model for addressing burnout as a distinct work-related phenomenon. So I am thrilled to be in conversation today with Shaina, who is a dear colleague and friend, and excited to talk about this important project.
Thank you so much, Laurie. I so appreciate you doing this little role reversal with me. You could think of no one better since we've been in the trenches together than no strangers to burnout here.
Absolutely. So I'm really excited to be in conversation with you about this. I know we've been talking about this for years now. And so to see, your work culminating in such an important book that I think will help others, I wanted to maybe just start off with how much I really appreciate how you weave your personal narrative into this clinical oriented book. So this book offers tools, techniques for folks. And I'm wondering, can you share with us a little bit about what brought you to working on burnout and burnout recovery and why this topic is important to you?
Yeah, absolutely. I think as a clinical social worker, oftentimes we're oriented to see burnout as an occupational hazard, something that we will undoubtedly encounter in our careers and something that we just have to endure that's comes with the territory. And I phased in and out of burnout and with different manifestations of it throughout my career. But when it came to a different level for me is during COVID, both you and I were in leadership roles in a hospital-based setting in a department of psychiatry and behavioral sciences. And the impact on the hospital system at large was just devastating, and how quickly that had happened. And there was a mental health crisis that really happened, not just to the community at large and the folks that were losing family members and friends and all of those things, but the healthcare providers who were simultaneously vulnerable still to the global pandemic and at heightened risk because of exposure in the context of their work, but just also the incredible suffering and toll that took to be a healthcare worker, certainly for frontline workers, but I think everybody involved in healthcare work at that time. And there was this incredible intensity of burnout, specifically burnout that was coupled with moral injury and seeing the incredible toll that was taking. And that burnout was also a entry point for people with really no significant psychiatric history becoming quite impaired and struggling quite a bit. And also for those who already had a history of behavioral health conditions that really exacerbating in the context of this. Our hospital institution mobilized a crisis mental health response. I was part of creating that programming. And in terms of developing the programming to serve healthcare workers in acute mental health capacity, because there's all sorts of access challenges in getting people into therapy, as all the clinicians know. The point was to really identify people fast, get them connected fast. So we had to do that in a lot of structural ways to try to create that. And in addition to developing that programming, I started to work with those folks in an individual psychotherapy capacity. So burnout was like the bread and butter of all of the clinical work I was doing, the through line of every single patient I was working with. Meanwhile, I was horrifically burnt out myself. So there was that sort of parallel process. And going back to your question about weaving in personal narrative, a lot of that we'll talk about the underbelly of this book are these two theoretical frameworks, acceptance and commitment therapy and compassion-focused therapy. And what I appreciate about them, it doesn't put up this hierarchy between a client and a provider. It talks about the universality of suffering. And I think for me, sharing my personal narratives was a way to share that component of a lot of the ways that I understand this is through my lived experience. So much of the mental health workforce struggles with burnout. This is a way I talk through and explain thoughts. I use story and metaphor a lot in my clinical work. And that was really important for me in the messaging of this book, that I shared clinical vignettes and composites of clinical vignettes, but I know what's gone on in my own head. And I think using personal narrative to talk through the inner private experience, which is so much of how we experience burnout was really an important way for me to get the messages, the core clinical messages of the book across.
Definitely having worked alongside you in the trenches of those dark days in COVID can definitely speak to how burnout was so pervasive. And it's really inspiring that in the face of all those things, even then you were looking at innovative strategies, whether they're systemic or interpersonal, to try to contribute to a better understanding of burnout. Like, there's something really lovely. It's like you workshopped these things literally on the front lines and have incorporated not only your own lived experience, which is so ACT, that we're embodying these things. And it feels very much that you've incorporated a lot of what you've learned in working with folks, so incorporating feedback from communities.
Yeah, that's really been the hope. And it was an interesting process to recognize what was working with my clients and having that striking moment of, I'm not doing any of this for myself. I am not showing up in my world with the principles of psychological flexibility and compassion. Certainly, I think at the height of my own personal burnout, compassion really was evading me. So I think in helping me think through this, I had these two different aims of, I wanted to more formalize a process of, okay, what am I doing with my clients that's working? And I am a very integrative therapist, so I'm usually pulling from multiple modalities. But the two that were really rising to the top were ACT and compassion. That seemed to really be what was translating for people and affecting the most transformation in people's day-to-day experiences and the way they were relating to themselves, their professional lives, and their lives more broadly. So that curiosity about, is there something here, and can I articulate it and put it together in a way that can be replicated by other people clinically, but I think even more importantly, just for folks that are experiencing burnout in their lives and may want to take a self-help approach to relating to their burnout in a different way.
As someone who's had the luck of reading it, I think one of the really unique things about it is how you weave in the personal narrative, and there is this embodied approach, and so it feels so much more relatable, and the skills just seem like they've been really tested on the front lines, and you offer a lot of creative alternatives to the traditional sort of like meditate more or take a sauna. I know we're focusing on healthcare workers. However, I think burnout is showing up everywhere these days, whether it be healthcare providers, education, leadership, caregiving, or just like navigating modern life, right? I think we're seeing burnout everywhere. So I'm wondering if you could share when you're talking about burnout, what are you talking about? What do you mean? And can you orient us to, in the book, you talk about how you're an expert at seeing burnout in the wild, and I love those metaphors. I'm curious if you could share with us a little bit about that.
Yeah, absolutely. So I would just say to operationalize it more if we're thinking about symptoms, which, and we want to just hold lightly, because I think that this does show up in so many different ways. And I really have come to see burnout as a creative survival strategy, much more than a collection of symptoms. But I do think that the work done by the folks who created the burnout assessment tool is most reflective of what I see in the wild, which is these presentations of primary symptoms and secondary symptoms. So the primary symptoms are extreme exhaustion, right, which is something that we'll see in almost every definition of burnout. The other is that mental distance, so that kind of disengagement and cynicism. But the other two categories they have, which I think is really important, is cognitive impairment. So I see that as both concentration issues, brain fog, memory difficulties, executive functioning challenges, but also cognitive challenges in terms of thinking and thought patterns and intense, intrusive beliefs that can be impairing in someone's day-to-day functioning, and emotional impairment. So this, I think, previously wasn't as talked about in the burnout literature, is just the intense emotional dysregulation that can happen when folks are burnt out. And that can look so many different ways. It could look like irritability. It can look like rage. It could look like sadness, shame, anxiety, self-doubt, or just general reactivity. So those categories are really helpful in understanding the primary symptoms. And then the secondary symptoms, which are really important because I think sometimes this is the context which people will come to us clinically in both mental health and physical spaces. These are secondary symptoms, are the somatic manifestations of burnout, headaches, body aches, sleep disturbances, GI distress, that sort of thing. That could be solo symptoms or exacerbate existing medical conditions, and also psychological symptoms. So burnout being a precursor to a depressive episode or more clinically identified anxiety syndromes. So that's what we're talking about when I'm talking about burnout, which was just like broad, right? For me, there is a lot of ways that this can show up in the wild. I imagine, and just hearing some of the primary symptoms, people can imagine it. But one thing I want to really name explicitly is this trajectory of fawning to a freezing/flop response in folks, because I think particularly this fawning response is missed. So when I'm talking about fawning, I'm talking about under chronic stress. And I'm going to sub in the word threat. And I don't mean this to minimize trauma responses or say a difficult work environment equals trauma, because I don't want to dilute what we are talking about when we're talking about trauma experiences. But in understanding the literature around trauma responses and understanding fawning as this appeasement to maintain safety and connection, for so many people, work is, in a very literal way, it's the way we survive. It's the way we feed ourselves and clothe ourselves and have a roof over our head. Also, for so many of us, work is a central place of identity and belonging. And for some people, they're maybe their only social connection. So there is a lot of our survival that gets wrapped up in our work experiences. And many people overfunction and overwork, people please, or their boundaries erode in what I see as a fawning response in work environments. And that is oftentimes missed in burnout because we often associate, if particularly traditional conceptualizations of burnout from Maslow's research, they looked at productivity, like drops in efficiency, as a burnout symptom. So we start to, in our very capitalist way, we start to look at burnout as, okay, when is your work performance being affected? When are you putting less? And for so many people that I work with burnout, their productivity is top notch, right? They're incredibly high functioning. I work with a lot of medical residents. These people work incredible hours. Like, it's just as a baseline, are on their feet all day, or doing high intense cognitive processing, making these very in-depth decisions at a rapid pace. And their productivity is rarely impacted. And usually sometimes they only get support or call it burnout when their productivity is being impacted. But I think that fawning response is what burnout really looks like in the wild, is that people pleasing, overwork, subjugating your own needs, just going specifically to some of the medical setting, people not using the bathroom, like people not drinking water, really subjugating what are truly their survival needs in the spirit of this overwork, because it feels so vital. And I see that really as a fawning response. For most people, over time, at some point, they will hit a wall, and it can lead to this sort of like freezing response or flop response where like they just collapse at some point. I think that's where we see those uptick of those secondary symptoms. Their immune system isn't working as well. They're getting sicker more often. They're struggling with more severe depression, more anxiety that's inhibiting their ability to function and show up in their lives. But I want to just draw attention to that fawning period where people are quote unquote successful and highly productive. And I would still say, and they're still burnt out. And I think our Western productivity systems make the suffering of people that are high functioning invisible. And when we talk about burnout, we look at cultural frameworks like Japan, and even in the United States, looking at completed suicides in doctors, I think those high functioning people are amongst the most at risk in many ways.
Yeah. I think it just speaks, I think, to the complexities, right? So one is I really appreciate and I think this is in part why I can see how your approach to burnout, how ACT and CFT kind of fit because they're contextual behavioral approaches, like centering the problem in some of these systemic issues rather than, hi, on the problem, it's me. There are these systemic factors. And I appreciate, actually, as a trauma therapist myself, I actually appreciate, right, naming how chronic stress still impacts the nervous system, and then how different adaptations, right, how burnout can be an adaptation to a system that is extremely stressful, and that in trying to capture people or trying to address prevention / catching people before it gets really severe, that we really need to look closely at those folks who are overproducing or doing everything, because that might belie actually that they're really suffering. And as you're saying, whether it's capitalist society or structural power dynamics in systems where, like, if you're a doctor, it's not okay to say you're not okay, where it's not necessarily safe to say that you're not okay. The expectation is you push through.
Yeah. And using my own personal narrative, and we work together closely, I think what I would describe as the pinnacle of my burnout. I don't know if you just observed by my work output that people would, if you use that as the definition, I don't think that people would see me as burnt out, because I think I probably was most productive when I was most burnt out.
And yet it belies something that is causing a lot of suffering that needs to
Right.
be tended to.
Yeah. So I think also for people that are listening, are you trying to outwork your burnout? That's a common strategy people do that is sometimes invisible to us as a burnout indicator.
Yes, the overworking definitely is something that I relate to in terms of my own burnout experiences, the kind of pushing through with the hopes that's going to solve the problem of burnout.
Relief
And
is right past this to-do list. Once everything is
exactly.
done, there it will be. So it's like that.
Then there will be relief, and yet there's
Exactly.
just more coming. Yeah.
Or some relief or some type of acknowledgement. And one of the things I talk about too in my book is financial compensation, which I think is so oddly oftentimes not involved in our burnout conversations. I think I had, I'll prove myself and I'll be compensated fairly. And that kept me in a very dark cycle of overwork for a long time, where I would try to do more, and that wasn't my sole motivator for my contributions, but it certainly, I think, was that survival one. Like I'm
Right.
feeling so financially stressed and stretched and maybe unfairly compensated, and if I just do more to prove that I am worthy of this, and then when it wouldn't come, instead of reevaluating, okay, like what's happening here.
So just to piggyback off of what you were saying in terms of the complexities of burnout, the DSM-5, right? Because you're describing how there is like a cluster of like primary and secondary symptoms that we could probably put into other diagnoses that already exist. And as we know, the DSM-5 is having a major overhaul right now. And there's ongoing debate about whether burnout belongs as a standalone diagnosis. And just curious what your thoughts are about, should burnout be considered a formal psychiatric diagnosis? And what are the like clinical implications either way?
Yeah. Not to give a non-answer, but I have so many internal questions about this. I will say this. I do think as a field, we should be doing more to treat burnout as a clinical target. But when I think about formally including it in this next iteration of the DSM, it pulls like a similar tension that maybe like the inclusion of grief did in the DSM-5, this sort of risk of over medicalization and over pathologizing versus the risk of access to care. And I similarly, not to, like, I see this also with gender dysphoria as well. That sort of we have to acknowledge this, talking about the context that we are in, where diagnostic categories shape treatment pathways, including reimbursement. One of the big risks, I think, is what I think is already being done in a lot of burnout interventions is blaming individuals for the experience of burnout, which I think are largely efforts to manage being inundated with chronic stress in work structures that reinforce productivity and profits as their primary metrics. So I think it's a tricky one I think some of the benefits or that it can improve treatment precision. It can help with early intervention. I think that it might be more welcoming and inclusive for folks that have a lot of stigma about getting mental health treatment. It will allow them to use their insurance versus I think a lot of coaching programs and non-mental health care have captured this group of high achieving burnt out professionals that are going elsewhere outside of healthcare systems. And this might actually give people access point back into using maybe formal psychotherapy, which can be an incredible tool in this burnout recovery discussion. But going back to that conversation of grief, like grief is a human process. It's not inherently pathological. But some people do experience prolonged impairing grief, and that it was complicated when grief was exclusionary for major depressive disorder, for people to get mental health treatment. So just burnout presents that similar challenge. It's a human response to chronic occupational strain in our culture. It is often distinct from depression and anxiety, yet it becomes impairing in these productivity-driven systems. And we just have to negotiate that line constantly between naming and supporting folks that are suffering and medicalizing it. So, yeah, I think that I would vote for maybe a Z code or a subtype of something, particularly for maybe looking at research around this in a different way. But I think it's complicated. And I also worry about, we have to also recognize our healthcare exists in this capitalist system. And there are some bad actors and people who are disconnected from healthcare workers and desires and motivations. And I think with grief, there, if you really look behind the scenes in this, and hopefully not in a cynical way, in a practical way, there were pharmaceutical influences that were encouraging grief be put into the DSM. We say, why would that be? And I wouldn't want something like to have those same skepticism about an inclusion of burnout in the DSM.
And it sounds like one of the potential advantages is destigmatizing what is human suffering, which is an adaptation to a extreme stress situation, right? So that it depathologizes. Hopefully it could reduce stigma, maybe access care, improve research, so people aren't just looking at intra-psychic processes, but also bringing in the contextual factors for folks, rather than, again, making the distinction that it's a personal failure, which I think often that is people's experience of burnout, right? Is that this is a personal failure versus, oh, this is actually an adaptive response to a very stressful circumstance. And what can I do to take care of myself in that or make other decisions? So I guess related, we're talking a little bit about not wanting to view burnout as personal failure, right? Not wanting to blame the victim. And, right, not everyone gets burnt out. And so wondering if you could speak to, just for clinicians to be thinking about, what are some of the individual vulnerability factors that might predispose someone to being burnt out and how that interacts with workplace culture to create burnout?
Yeah. So I think shame amplifies burnout. So folks that might have more of a sensitivity through framing psychological discomfort through the lens of shame. So just differentiating from guilt and shame instead of saying, I didn't get that promotion. That's really hard. Guilt might say, perhaps I could have put more effort into these projects that I did. I'm frustrated with myself. While shame says, I suck, I'm bad, I'm stupid, I don't have any value here. So I think that because shame is, again, so inherently disempowering, that when we feel shamed, understandably, if I am the dysfunction, right, then I either will try to just hide from that experience, usually through some sort of soothing or numbing strategy, or I will try to become someone else through Herculean efforts to do that. And that framing of shame and understanding the chronic occupational stress and what's coming up there certainly amplifies burnout. I think we all experience shame. I see a lot of the people I work with who had some manifestation of either complex trauma or persistent trauma in childhood or chronic invalidation, where shame wound up being some adaptive way to preserve attachment, tend to struggle more with shame in professional contexts. So I never see empathy as like a liability, but I think in exploitative systems, it can be a pipeline to feeling more shame. There are perhaps different vulnerability, but if I'm thinking about that's maybe the primary one that comes to mind. And because that can also manifest in things like perfectionism. And now I would also say that, like you were saying, the context of things matters. I think folks who their physical or social location already makes them more subject to marginalization in the world are going to also be at different and elevated risk for burnout. We see things like people of color tend to have to face more bullying and harassment at work. Women tend to face more sexual harassment at work. Unfairness is a big systemic risk factor for burnout, and people who are already treated unfairly by society, no surprise, are typically treated more unfairly at work. So I think that is also something that we have to be cognizant of in this people's physical and social location. So obviously things like race and gender are part of that, but also things like people in bigger bodies, people with neurodivergence are sometimes also that unfairness, but also being shamed at work, also being shamed by others at work is something that I can see also being a huge amplifier of burnout.
Absolutely. And it seems that if, at least when I think about some of the workplace cultures that have higher rates of burnout, like when you're thinking about healthcare workers or even like high productivity lawyers or business folks, there's a lot of shame about you didn't work an 80-hour work week or you want to take a vacation. No, the expectation is your phone is on all the time. And so there's shame embedded in the context that you are bad if you are not always available, or you are bad if you are not just performing at 100% at all times and not complaining.
Absolutely. And shame is a really great control strategy for social control. So I think things when we're looking at things like medicine and the deep hierarchy of medicine, when you think about residents and how smart they have to be to get through medical school into residency and how low they're paid and how many hours that they work, I think there's also this part of if you don't use shame as social control, that entire system falls apart. So there is this sort of mirroring of almost, I would say, I see parallels to like militarized structures where hierarchy and loyalty to the team and ignoring your own suffering are these traits that are really moralized, and people are really shamed for taking care of themselves and in the most basic of ways, like stopping to eat lunch after 8 to 12 hours to drinking sufficient water. I just go back to those examples because I think they just are so illustrative of these things, but certainly.
And so common.
Yeah.
right?
Yeah.
Like it's so common. I can think about many people that I work with that it's like, how can we find ways for to use the restroom on a 12-hour shift?
Right.
One of the things I really appreciate about your approach is that it's not just focusing on what the individual can do, right? Yes, we want people to drink more water. We want them to eat and sleep and rest. And there you are bringing in systemic factors, right? And I'm wondering, how do you, like when working with folks, like how do you validate these kind of structural contributions like workload or discrimination or productivity hustle culture without disempowering the client?
Yeah. So one of the tools that I made in doing this work is I do a workplace report card, and it is based on the research of Maslach and colleagues about the systemic drivers of burnout. So we look at these 6 primary drivers: workload, autonomy, fairness, community, values, and recognition. Those 6 systemic drivers of burnout, we literally just say, like, how is your work doing? We could do old school, like A to F. A is excelling, F is failing. And we go over those domains and we have the client just give it a subjective grade. And I think it's a way to start thinking about these are the different systemic factors that are affecting my day-to-day work experience, even in really burnt out people. Sometimes at first I'll be like, yeah, F across the boards. But if we really work through it, there usually is some differentiations, even if it's like a bunch of D's and maybe there's one C and a bunch of F's. But
D minus.
exactly. What I want to do is one, identify if there's any systemic strengths in the place that they work that they can build on, right? Like I can say, like with residents that I'm working with, something like recognition, right? Like they might broadly feel like through their compensation that they don't have recognition, or maybe there's one attending that just grinds them and is just so devaluing to them. But then they'll have a really supportive program director or a few mentors within their community that really see them and really uplift them, or their cohort of residents are really nice and affirming. So I think we can go through those systemic domains and talk about them with some nuance where people can find spaces for empowerment, but also have that conversation of validation of, yeah, you're working 70 hours a week. That overwork has a direct contribution to your health, and that this raises the risk of stroke. That sort of overwork can like really be a carcinogen, and not to create a level of fear and hypervigilance, I think, to ground people in the context that they're at and then explore their behavioral choices within it. And then start to say, okay, given this and that, like that this is an F, right? What can we start to really work on here that you have choice around to start addressing? Like there's a huge issue with autonomy and control here. You have an oppressive work system in many ways. What are there tiny micro decisions where you can start taking some choice back? Or if it's about community and that's an F there. Are there tiny ways that you can ask one coworker their name or spend time? Is there some ways you can ask to work with someone on this project? Are there tiny ways we can start to build that back? Not that it's their responsibility to flip their workplace from an F to an A or anything, but to recognize there's systemic oppression there. So that's why they're feeling the way they're feeling.
I think that's really helpful to think about, because I think that combination of the validation of the structural forces of oppression, it makes sense that you're feeling the way you're feeling. This is what happens to a human nervous system, a human being, a human mind, a human body when it's under this amount of stress. And, right, holding the other side of the coin of, you talk in the book at some point about distinguishing control versus personal agency. And this is tapping into that for me a little bit, that even within systems of oppression, there might be small movements of personal agency that they can start playing with a little bit.
Yeah. And I'm so glad you brought that up, because I think that has been probably the most impactful for my clients. If there was one thing where I said, this is the most helpful thing, that it is hard to move high achieving people out of control strategies. It's hard to get people on board with that. And I think this languaging around choice over control and using personal agency, and that there's anchors to that. I bring myself back to this mentally all the time. that in most moments, and I'm sure there's some exceptions, but I would say in the most moments that there are three things that you have access to, no matter what the context. And that is what you focus on. And that could be internally in your body, what you focus on and what's going on around you, where you put your focus, the meaning that you make of things. So not your automatic thoughts, not your how your mind is interpreting the situation in real time, but you're saying like, what do I want to make this mean? And then your behaviors, what you either do or don't do in that moment, that micro decision that is available to you in any given moment. And I think this is so important because sometimes when we talk about control, we act like everybody has the same choices. And no, that's not true. And we don't even have the same choices day to day, moment to moment.
Right.
But I think we don't have to go to this extreme of I'm powerless. I have no control over my life. I'm just a victim of my circumstances. And especially for folks that are living in oppressive systems that directly threaten them because of their color, their size, their physical limitation, their disability, etc. If we just think you're screwed, sorry, the system is rigged against you, then that I think is just as harmful as ignoring that these systemic realities exist.
I think that's a really important point of that sweet spot of validating while holding on to hope without validating and falling into just a sort of colluding with despair. So as I'm hearing you talk and as I've read the book, it makes sense to me, but I'm wondering if for those that are listening and may not be as familiar with ACT or CFT, I'm wondering if you could take a moment and just talk about what led you specifically. I know you were talking about this a little bit before, but maybe fleshing out a little bit more what drew you to ACT and CFT as models to address this.
Yeah, absolutely. So I would say for where I saw acceptance and commitment therapy being most impactful in the work that I was doing before I formalized this, and was like, I want to put these two things together in a more direct, integrated way, was just recognizing the level of experiential avoidance that was coming up for folks that I was working with that were burnt out and high control, a lot of control strategies. And also this like rigid pursuit of work-life balance. I hear that all, I want more work-life balance. I want more work-life balance. And there was a sort of a rigidity around that was the only pathway out of burnout is like when you could achieve work-life balance. And there, I heard all different definitions of what that meant to people, but they were usually locked in pretty tight. So I think ACT and moving towards looking at how psychological flexibility processes can be helpful for people to move towards lives, including professional lives of meaning, where distress and pain could be part of that experience and being able to learn to be with that without needless defense. And by what I'm meaning that is without reflexively going into high control strategy mode. So I think that's why it felt like it paired well with the work I was doing. And then I think ACT, I think inherently has a lot of compassion built into the process. I think that willingness or acceptance work tends to be a process that is inherently infused with self-compassion, decoupling from very intense self-narratives that oftentimes are critical and unkind to self can be inherently be like a compassionate practice. But I saw a lot of people getting stuck, even that took really well to ACT concepts when they didn't understand their own shame and their only conclusion was like the content of their shame must be true. Those were the hardest things to diffuse from. I think the psychoeducation that is inherent in Paul Gilbert's compassion focused therapy about shame and why shame may exist as this sort of self-protective mechanism is really helpful. I think the overall simplicity of understanding the evolutionary model of the brain and our tricky brains and how all of this stuff comes up, it's part of our human condition, and that we all are living with this conundrum of how our older brain systems interact with our new ones, and then how that so much of that is an explanation of our human suffering. I think that unlocked stuff for a lot of people that let them move towards acceptance, where I think it was otherwise difficult too. The other piece that I appreciate about compassion focused therapy is it put a little bit more attention on purposely generating compassionate, warm, positive internal experiences, where I think the work of ACT, which is so meaningful and important, is not moralizing any of it, being with what is. But I think for a lot of people that are so depleted, they also need to know how to access and generate warm, positive feelings. And so there's compassion focused therapy work. I think also sprinkled in there is some positive psychology, because I think that for me felt necessary to make the most headway with people, because moving in the service of your values in the face of pain is critical. And I do want people to feel better. And I don't think those things are mutually exclusive, and I don't think they're in contrast to each other when we're doing this in a thoughtful way.
Absolutely. No, agreed. And I do a lot of ACT work, and I also infuse some CFT. And what you said that resonated with me is how the psychoeducation piece around the 3 emotion regulation systems with folks, when we're talking about whether it's burnout or trauma, can be really powerful. Talking about that, as well as like how the chronic threat system sort of activation shapes burnout. I'm wondering if you could just take a moment to flesh that out a little bit more.
Sure. So Paul Gilbert's 3 systems of emotional regulation talk about the threat system, the drive system, and the soothing system. Threat system is the dominant system. This is better safe than sorry. When we feel like we are actively threatened in some way and compromised in some way, our body and mind respond in kind to protect ourselves. We're getting that activation of cortisol, adrenaline, the sympathetic nervous system to gear us up for self-protection. So there's that behavioral narrowing, which usually puts us into some sort of fight or flight direction of self-protection, and expanding what I was talking about in that burnout or fawn or freeze or fall. And if there's a predator, if there's a direct threat, of course, we need to be able to do that for ourselves. And then the other system of drive is the thing that helps us go out, collect resources. In our ancient ancestors, forage, hunt and gather, all of those things build. So these are what we associate with dopamine, seeking resources, motivation, energy to pursue what we need to do to survive. So we can see threat and drive directly related to our imminent survival. This is how you survive the day, is some combination of threat and drive. In our modern context, drive is also associated with social status and seeking of proximity to things that we see as resource allocation that is going to keep us safe and high enough in a social hierarchy to protect our status. So what happens in burnout is people are ping-ponging between those 2 things. Oftentimes, I found this for myself incredibly true, use drive strategies, behaviors to try to get out of threat. And I think learning that drive has so many important applications for survival, but it will not down-regulate our threat systems. It does not tell our threat system stand down. It actually can keep you in a loop of activation. So in burnout, the 3rd emotional regulation system is often the neglected one, the forgotten one, which is the soothing system, which is incredibly important to our long-term survival, which is what we want, right? For most of us that are employed, that we are ideally, now this is obviously subject, I think, increasingly as we see income inequality continuing to split in our country, becoming more and more of a real issue. But many of the people that I work with are resourced enough that they have access to food and clean water and housing that is relatively safe. So no imminent threat, tummies are full, but can't move into that soothing system. And that soothing system is where we feel like the endorphins and the oxytocin, all those good feelings. But it's really about connection. It's about feelings of safety. It's where we can go into that rest and digest. Our immune system can start to work, where we can get restoration that is needed to live longer and live well. But a lot of our societal messagings about rest are really toxic. And for a lot of people, when they are in this loop of thread and drive, they don't know how to get out of that. And I see that really like a lot of people, myself included, do not know how to turn off and get into this soothing system, which Paul Gerber says is an essential human drive that we need for our long-term survival. So I think that too is not seeing rest as a luxury or an indulgence. That is a psychoeducation piece that this helps trump in a different way. I think I have tried to communicate that to folks, especially doctors, without this psychoeducation. And I would say this makes it much more sticky. I get more buy-in when I'm using this framework to help them understand their burnout and what's happening, but also understand that the use of compassion and self-compassion on a neurobiological level can actually get you into this state that is going to help down-regulate your threat system, activate your parasympathetic nervous system, and actually have a reparative impact on your body and your mind and your emotional regulations. People don't need to survive burnout. People are in survival mode when they're burnt out. So we have to teach them how to get out of survival mode, and that can be really tricky. And I think these two things have given me the language and the clinical tools to do that most effectively.
And just hearing you talk about it, it makes even more sense to me, bringing in the ACT component, particularly as you start leading into exploring the soothing system with folks, and they might be fused with certain beliefs about rest is lazy, or I have to be working all the time, that these kind of perfectionistic or capitalistic or things that are focused on power and achievement that our minds are so fused with. And so learning diffusion and acceptance along with as they're accessing the soothing system seems really synergetic.
And I think the other piece is people thought they were resting when they were really in drive. That's another component. I go home, I bed rot, I go in, I'm on my phone, I'm scrolling and watching one horrible news story after another. You're still in drive. Or I am online shopping, you're also in drive. I go to Orange Theory and I do a high intensity workout. Nothing wrong with that's important, but if you think that's going to be the thing that down regulates your threat system or that it's soothing, it's not. So that doesn't have to go. That can be an incredibly important thing if it's a value for you, if it means something to you. But if you conflate that with you resting or some kind of self-care that's going to regulate your nervous system in that particular way, it's not going to happen. I see that too with people with eating, shopping, dating, that they're using drive to soothe. And it's not that any of those things are inherently not helpful, but we have to help educate people on the function of those behavior, both behaviorally, what's the function for them, but what's the actual nervous system impact of those.
Their mind is going for these dopamine hits to sustain them. And in the long term, it's likely unworkable in terms of thinking about their nervous system and their well-being in a more holistic way.
Yeah, absolutely. I work with so many people that deal with chronic pain or illness of some kind. Autoimmune conditions is a lot of the things that I see with my folks that are high achieving, and they've also gotten such shaming message about resting and what it means to rest. And there's a lot of masking that gets kind of pulled into it. And I think being able to give this, there's not a formulaic thing where, the dosage of rest is exactly prescriptive for every person. But I think recognizing, someone with an autoimmune condition probably already is going to need more activation of their soothing system to feel okay and able to show up most of the time. And, I think when people do rest, I'm doing it in air quotes, but they feel highly activated and shaming at the time, I don't know that they have truly are having the nervous system impact of truly resting.
Right.
So many people I say are like collapsed on the
Right.
couch, but they're like screaming at themselves, like, you should be doing laundry right now. You should be washing the dishes. You should be doing your notes. You should be writing the paper. You should be updating your CV. And I would say that is you still like the illusion of resting, but like really still being in a drive mode with those thinking strategies.
Yeah. Yeah. So I guess like it's similar to what you're saying in terms of what rest, it's making me think about what rest could look like and how that can be really values driven, right? So for some folks, it could be more of the tend and befriend, right? Versus what we think about like active rest. So just thinking about in the Beyond Burnout Blueprint, you start with values driven vision, right? Rather than symptom reduction. So I'm wondering if you could talk a little bit about that, particularly coming off of this notion of rest or integrating the soothing system.
Yeah, I think that going back to those control strategies, and a lot of people, when I'm trying to get clarity about what is important to them and what they want, they'll answer with what they don't want. They'll say, I don't want to be a failure. I don't want to let my family down. I don't want to run out of money, very understandably. I don't want to feel rejected. And so much of their life is organized about not wanting to lose status or not wanting to have certain emotional experiences, even when they're really pushed. And we sometimes have to do some work to get back to creating a vision that is empowering for them. You were talking about not everybody gets burnt out. Ironically, some of the people that I've worked with that are the least burnt out in my experience are immigrants and work incredible hours, like a lot of times, a lot of intense physical labor. It's almost never aligned with what they personally want to do. But oftentimes there is a external vision that is so, oh, I'm doing this to send money back to my family. That's so important to me that I'm happy to work. I'm excited when I have the opportunity to work. And there's incredible work ethic that comes because it's the vision is mapped, like it's so embedded in the work experience that there is no separating it. When they are showing up to work, they are showing up for their family. And those two things are united and tied together. For a lot of people in the United States, there's a lot of pressure put on your job because your job is supposed to give you meaning. Your job itself is supposed to give you purpose. And when the work itself is pushing up against your values, feels not acknowledging, not appreciative, disregarding you, then it puts a lot of people on the defense. And what I want to help people do is find a vision where it's easier to endure the challenges of the day because there is some central connection to something that is deeply meaningful and inspiring, important to them. So moving that broader ACT vision of moving towards versus moving away. But we're humans. We think in stories and like it's why we can go to see a movie or something and it moves us more than if someone just told us about something that happened, because the more depth and emotional resonance something lays to us, the more inspiring it is. And I think motivation is really not a good tool for behavior change, but I do think inspiration can be a really important tool for behavior change. So starting there of trying to create a vision that is either it can be grounded in the work itself, but if we don't start there, I think everything else that follows is a lot more challenging. And sometimes people do have a vision, right? That they have a vision of who they want to be and how they want to like see themselves, but they're so critical and so harsh that they're not there yet, right? So everything is perceived in this lens of deficit and beating themselves up for not already living their vision or their accomplishment as they see it. So that's the second part is one, getting out of creating a life about what you want versus what you don't want. And two, having a relationship with that vision that is compassionate so that you can move towards it and your focus, meaning, and behaviors are aligned with moving in the direction rather than this like lashing yourself for not being there, because that people get paralyzed and stuck and resentful and burnt out when they do have a vision, but they have a very negative, nasty, critical, shaming relationship to it. That's part of the reason I feel like it's important to start there.
Yeah, no, for sure. And I think just coming back to what matters can be incredibly mobilizing for folks. And I think often, at least in my experience in working with folks who are burnt out, they've lost contact with like why they're doing what they're doing, or what is underneath, what do they really care about that led them down the path that they are, and that it can be incredibly powerful to get people to tap back into that and maybe re-envision what it looks like to tap into those things that are meaningful. Maybe the way they're going about it is unworkable, or maybe the context makes it unworkable. But yeah, I think it could be really powerful to come back to what matters rather
Yeah.
than let's just focus on you not feeling so bad.
And I think it's a way to get people thinking about this concept that I think is really tricky, like self as context in a different way, that you are not just the job or role or income or title that you have now, which I think is especially important right now because the economy is such that it is you can't just leave a job necessarily because
Right.
you're burnt out. You can't just get a promotion because you deserve one. And that I think that's always been the case to some degree, but I think right now with the volatility in our economic and political system, a lot of the response of employers is like hiring freezes, or things are just slow, glacially slow. So I think there was a point in time where we were like, okay, great resignation, quiet quit. You just leave if you don't like it. And that's not available to a lot of a realistic way. And something that I talk about sometimes is I listen to a lot of personal development and business podcasts. You hear these CEOs, and this is like across the board, that have incredibly successful companies, are doing huge things, have a lot of money, a lot of power. Try to listen to people I think are decent people because it can get tricky nowadays. That if they're asked like what's the best job they'll ever have, they'll talk about like when they were the lowest level assistant for somebody, or they'll talk about when they were a valet parking cars, and they'll talk about when they were waitressing, and they'll say, oh, that helped me meet people, that taught me how to talk to anybody, that taught me like how to be a brainstormer. And that's I think the kind of imperative of having a vision, is that you don't have to be there in some like 3D physical form for it to be real. It means that wherever you are, you can see the thread of what you're doing now and who you're becoming. And that makes every single day easier. That makes every single day feel meaningful. And that loss of meaning is what really corrodes a lot of people's experience, because they spend so much time at work. And when people feel, that's one of the hardest things that I see, is nothing I'm doing matters. Nothing that I'm doing is helping people. Particularly painful when people, and not only am I not helping people, I think I'm hurting people. I think what I do is complicit in hurting people. That's really hard to support people through if we don't have some strategy to do that with.
Yeah. So you've used the word compassion a lot, and in the book you talk about fierce and restorative compassion. I'm wondering, can you talk about why both of these are necessary and maybe unpack each of those, what the difference is?
Sure. Obviously, I think anybody who's doing some kind of compassion work is inspired by the work of Kristen Neff, who's the premier researcher on this subject, and overlapping with her concept of the yin and yang of compassion, and that yin being that more restorative compassion, what we think of that like nurturing, gentle, soft kindness that can be really necessary, and that more fierce compassion being advocacy and resistance, which is so important right now, and action oriented and strength based. And I think compassion has a really bad rap. In addition to working with high achievers in the burnout context, all of my work prior to that, working with people working in the Bronx, and people that have endured a lot of systemic oppression that has led to a allocation of resources that leads to a lot of social determinants of health being greatly compromised in the Bronx community, including community safety for a variety of compounding reasons. And I think in doing work with folks over the years, there's a lot of fear about that restorative compassion alone, even though I think it's so critical, that this idea that sort of compassion makes you vulnerable and makes you weak and will leave you more at risk of future harm. And being able to use that three-system model of Paul Gilbert's work to advocate for why that restorative compassion is so important to being able to show up and live well, and that it can be directly tied to showing up with more effectiveness in drive and threat systems, but also saying that compassion is not inherently weak, that there are ways to show up with compassion that are strong, and that some of the people that you admire the most, if you really track back what they have done, whether that's like your grandmother or a civil rights activist, that most of them have been embodying some sort of fierce, compassionate practice that is the backbone of their strength. So I think that can be meaningful to even allow to reconceptualize what compassion can look like.
Yeah. I mean, I think it's such a tricky word, right? I think it elicits a lot of reactions in folks because they have a lot of predetermined notions of what compassion is. It's woo, that it's like weak, that it's like mushy gushy.
It's like
When
pity or like being a victim to a lot. Yeah.
yeah, when in fact, right, when we're talking about compassion, it's often about courage and bravery to be in contact with the suffering, either of yourself or another person, and then the willingness to take action. I think people's ideas of what it is, they don't doesn't always map with maybe the definition that we as psychologists are like, no, this is actually really hard to do. It takes a lot of courage to be in contact with your pain and then lean in and take action, take compassionate action. What would that look like for you? So I think it's really useful to start broadening the definition of compassion, and again, having people start to play with it a little bit, right? Whether it's the fierce compassion of saying no or setting boundaries. And then even the languaging of restorative compassion, I find is really helpful. Just if you're using metaphors like you charge your cell phone, don't you? So compassion is something for you to recharge yourself. So you're wondering why you're so exhausted and running yourself down. You have not recharged yourself. You have not restored yourself. So how are you going to continue to do what matters? And that, I think, gets people out of that fusion with what compassion is or is not.
Right. And that we don't moralize having to charge our cell phone. We don't say what a
Right.
piece of shit this phone is because I have to charge it every X amount of
Right.
hours. But I do love the example you brought up of courage, because I think that is this trickiness of language that I think you and I would say courage is showing up in the face of fear, right? But I think so many people interpret courage as the absence of fear. And I think that is a lot of the embedded pathologizing of emotions that has happened in our society. And a lot of people think compassion means like oozing into this like all loving, like
Big hugs.
yeah, non-judgmental, with no self-preservation and no backbone and no strength. And I think really actively working for people to redefine it, break that down by helping people say, who do you admire? And seeing them, being able to see them as both strong and compassionate, and that strength being directly related to their compassion, not in spite of it.
Yeah, absolutely. And I think you talk a lot about this a little bit in your book in terms of, again, trying to help people get untangled from whatever notions they have about rest, right? Because I think compassion, restorative compassion, rest, that the self-care movement has gone a little bit awry in our Western culture. And yet there's a deep, rich history underlying it. And I think about the work of Audre Lorde and seeing rest as resistance. And I'm wondering like how much you might bring those kinds of things into conversation with folks.
Yeah, I do think knowing our history, knowing that, of course, the self-care movement was co-opted, commercialized. And that's not to say that there can't be utility if you value beauty or relaxation, but consumption alone as a self-care strategy is really problematic and is really keeping people in the very cycles that keep them burnt out. That's really how I try to communicate it, is consumption only is a struggle. I think when you see very young children enjoy and at play, it's usually being just like doing. It's not, unfortunately, because they're in this society as they get older, and then it becomes more heavily embedded in consumption. But I think our truest connection is oftentimes not consumption driven. The biggest act of self-care I think I've done this year is going to protests where it felt like a meaningful pursuit, right? So the way that I try to talk about self-care in the book is thinking about these 4 different domains of self-care, and they have different utilities, and I think they're all necessary and needed. And again, I think this is highly individualistic, but one is that meaningful pursuits. What are you doing that gives you a sense of meaning? And that could be going to a protest in this collectivist way. It could be taking care of your grandmother. It could be going to a Pilates class and noticing that you're getting stronger and better and more skillful over time. You get to decide what gives you meaning in your life. But doing something that feels meaningful to pursue, I think, is one of the things that we look at and can be a really important anchor of self-care. The other is presence, right? So practicing being with what is, and that can be traditional mindfulness. We do so much task switching in our culture. So I think even doing one thing at a time, because a lot of people have a little a yuck response to mindfulness. So just doing one thing at a time and doing it all the way and throwing yourself into it is an action of presence, whether that's taking a walk, whether that's painting, doing something where you're doing it fully, listening to a song, just doing it all the way. Connection, so doing something with someone else, and that someone could be a pet. I tell a lot of my clients of that, but connecting to some other living thing that you care about that can have some direct reciprocal relationship with you, being in relation with people and doing it in ways that evoke feelings of connection, so meaningful connection. So I always celebrate everything counts, but I do think things like laying in a bed, everybody being on a screen, that isn't necessarily connection, bringing the intentionality that whatever the activity you're going to do is for the purpose of connection. And the last one is rest. So what does rest actually look like for you? And that might be more of those consumption driven things. It might be getting a massage. It might be taking a bubble bath. I know there's so much like self-care is not taking a bubble bath. What I would say is that's not all it is. And it's also not a one and done, I think. And it's also about the relation you have to the thing you're doing, right? So if you are communicating to yourself that I'm going to get into my nicest pajamas and I'm going to watch The Pit and I'm going to curl up with a cup of tea and I deserve this rest, that is a very different act of self-care than being like, I had a shit day. I don't want to feel what I'm feeling anymore. I'm putting on The Pit in the background and I'm not even in the room while all of this is happening.
And it also makes me think about, you're saying it's not a one and done, coming back to the principles of ACT in terms of changing behavioral repertoires. It's about this being consistent actions. How are you consistently showing up in this way for yourself? So it's not just, okay, one night a month I'm doing it. Like, what are ways that you can be building in behaviors that tap into rest and connection in more regularity?
Yeah. And I'm so glad you said that, because most of the people that I work with, what they don't have is time. So time neutral self-care is something that I talk about in the book of how do you take what you're already doing and infuse compassion into it. So if you're brushing your teeth, how do you use that as a moment to take care of yourself? If you are commuting to work, what are you already disciplined about? What do you already do that you don't have to give a lot of thought to? And can you make that slightly more in the direction of something that's important to you? If you're getting on your phone to scroll, could you text your friend, love you, miss you, as like a way of connecting? I get a lot of fear of, I don't want to text because then what if they text back and I can't take on one more thing? So they just ignore people that make them feel good because they feel guilty that they haven't responded consistently enough. And if I'm not showing up in the perfect way, then I can't show up, and it feeds upon itself. So I think we try to get out of rigidity and saying, let's look for the lowest capacity way you can take care of yourself. What's the lowest capacity way you can connect to your values? And it's like a return on investment. When you start to do at that very, like, the lowest cost of entry, start to be more compassionate or take better care of yourself, you open up a little bit more energy, and then you could take a little bit better care of yourself or do a little bit more. I like to think of self-care as a return on investment. Are you doing things that are depleting or energizing? Talking about those cycles like behavioral repertoires, I used to take like a hot bath every single day because I did it since I was a kid. I think it was just the way I got conditioned to deal with some things that were difficult for me. And like it was alone time and I was away from people, whatever. And it would take to draw a bath and take a bath. It takes time. I realized like in my 30s, oh wait, like I actually feel like more drained after taking a bath. I thought this was a self-care activity, but it's taking up time. It's taking out energy. I don't actually feel better afterwards. And when I do an inventory with most people, there's a lot of things like that they just do because they're on autopilot and they've always done them, not because they necessarily are giving them an energetic return on investment. And we have to think a lot about energy preservation and energy restoration when we're thinking about burnout.
Yeah, no, that makes a lot of sense. And I think being curious and non-shaming, right? Like, ugh, even I feel depleted after a bath, I'm such a mess, versus, oh, like with curiosity, like maybe this isn't a thing for me anymore. Maybe I need to be doing, maybe cold plunges make more sense for me, right? Let me check it out. But again, that narrowing that happens with the threat and drive system versus when we're activating the soothing system, right? There's more openness, expansiveness, curiosity, right? And that's another way, I think, right? As you're starting to activate the soothing system, hopefully seeing more flexibility and more willingness to explore different ways.
Yeah, absolutely.
So I know we've touched on a lot of the blueprint, but I'm wondering if you could just briefly walk us through the arc of the six-step framework and how the pieces build on one another. I know we've talked a lot of the components, but maybe just zooming out, bird's eye view, like what the arc is.
So one is that what we talked about was building the compelling vision. That's part one. Two is welcoming the unwanted. So this is really about that component of experiential avoidance of, okay, now that we're saying, let's build a vision about what we want, that doesn't erase all of the things that are difficult and painful that we've been avoiding, right? So we have to develop some skills to be with painful internal private experiences, whether that's beliefs that we have about ourselves or other people, whether that's emotions or feelings that feel particularly difficult, body sensations, memories. So that strategy is about cultivating willingness and figuring out to do that in a way that does not dysregulate us to the point that we're going to be like over that. I'm never trying that again. And that's what a lot of times happens is when people try things like mindfulness and other strategies, they get kicked out of their window of tolerance because they haven't paced it. They haven't given the permission to take it slow and steady and find what works for them. And then they understandably say, that's not a safe thing to do for me. So that's what that chapter is about, is trying to hopefully integrate safe ways to be with what you've been evading and welcoming it in not to perpetuate your suffering, but to give you back energy, right? To stop siphoning off energy from suppressing and pushing away and rejecting and outworking what is already there within you and freeing up energy and by learning to be with it. And the third is watching your words. We started to talk about that languaging is important and how we understand ourselves and our lives. Like we're narrating and communicating that all the time. So diffusion, cognitive diffusion, specifically talking about how we're talking about ourselves, our inner monologues about ourselves, and being conscious of it. But also some practical things that probably draw more traditional cognitive behavioral therapy by looking at languaging and thought patterns and seeing if we can swap some things out for language that I think can be shame-inducing and threat-inducing, and swap them out for more compassionate and non-threatening language as a way to buffer and be a bit self-protective. Also talk about in that chapter common burnout languaging traps. So I'm a recovering ventaholic. A big way that when I'm burnt out is I vent and I talk about it, I talk about it, I talk about it. And venting in small doses actually can be soothing. It can produce some oxytocin. It can help with bonding and connection. But when it's done reflexively, when it's done, again, that behavioral repertoire where I would just like, before I was even out the parking lot, I'm calling someone and I'm letting it go, all my gripes. And it can keep us trapped and it can keep us fused with perspectives that are inflexible and are intensifying your suffering. And also, I know for me, like I spoke it so much into existence when anything was happening that countered that. Say I was appreciated or I was validated, I like push it away. It wouldn't like really penetrate my experience. I wouldn't let it myself see it. And to my own detriment. So we talk about venting, complaining, and also self-advocacy. I think there's so many people that are inappropriately judged and devalued for speaking up and self-advocating. So I really try to be mindful that I don't want this, particularly for people of color, Black women, to encourage people to code switch or not advocate for themselves. But I want to give people strategies that they're not speaking up in a way where it's really a control strategy. It's really a way to deal with anger or overwhelm and being able to communicate what's going on for them in a way that feels values driven and that we can check in that we're not in a activated threat state. So we give ourselves the best opportunity to be heard. The next one is identifying your unique gifts. So this is where I kind of sprinkle in more of the positive psychology components a bit, but also I see this as compassionate behavior. It's part of an extension of compassion-focused therapy, is how do we start to notice, name, and broaden on what's already going well, what we're doing well, what our strengths are. Another thing Paul Gilbert talks about is how threat gets activated in highly competitive environments. Compassion goes down in highly competitive environments. So how do we also show up in ways identifying our own unique gifts, reducing perfectionism, increasing confidence in a way that also allows us to see and appreciate the gifts of others and move towards collaboration instead of competition, particularly like hostile competition, which I think happens in a lot of work environments. And then next is being kind to yourself and others, which I think ironically I put later in the book because I think it's hard for people to talk about the barriers to self-compassion and get really granular about what does it mean to treat yourself well, treat yourself with respect, talk about some of the systemic barriers to self-care, those foundational things we need to do to take care of ourselves. That can be so annoying when we're burnt out and we go to a wellness webinar and they tell us to drink more water and exercise more. And you're like, go fuck yourself. Because and for a variety of reasons, that's also systemically unavailable to a lot of people. And we being able to talk about how can you get foundational self-care done no matter what environment you're on? How can you do the best you can with the resources and capacity that you do have? And then hopefully building out to more sustainable self-care practices. It also talks about things like, which maybe feel like they have no place in a burnout book, but I feel like they do, things like forgiveness. I think resentment comes up a lot when it comes to burnout. I don't think forgiveness is required to move through burnout, but I think it is a strategy we should offer to people in the conversation of if that might be something that is meaningful for moving through their suffering, and how to extend compassion to difficult people who feel threatening to us at work, because I think that can also be really impactful in moving through burnout. Going back to that 3 regulation system, that when we have like a work nemesis, or if our boss feels threatening to us, it's going to keep us in that activation. Now, I would love if I had some strategy in here of like, how do I make your boss not the worst? How do I make that awful coworker you have stop being so nasty? I don't have that in this book because that is not something that is available in most people's
Right.
personal agency to make choices around. So we have to give people some strategies. How do you change your relationship with that person so there's less internal activation that gives you more choice? So that's also part of that chapter. And the last one is letting your values take the wheel. You will not be able to function and make choices and intentional choices from your values 100% of the time. So we have to normalize drift from that. And that chapter is really about giving people tools to mm, how to prioritize things when you have multiple values that are competing with each other. I think that's something we don't talk about enough. How do you compassionately show up at work and actually make behavioral changes that are going to move the needle in terms of your burnout? There's a lot of things I unpack there. Boundaries is a big part of them. Like, how do you actually set and maintain boundaries? What is a boundary? I think we conflate boundaries often with asking people for what we need. Also important, not a boundary. And this concept by Robin Walser that I really love called compassionate immediacy, which is like kind of this balance of, I say a lot in the book that direction is more important than speed, and that, but also this paradox of having some connection to the vitality of your life, and that how do we start to show up today immediately and care deeply about the lives and the moment that's in front of us, just because of the impermanency and the fragility of all of it. And then I have some additional chapters outside of that about systemic and issues and leaderships and big grand goals of like, how would it look if we really brought compassion and psychological flexibility to scale, which is just, again, part of my compelling vision. So that's the outline of, or the framework of the book. But those 6 steps are really the individual kind of framework of moving through burnout recovery.
Thank you. I think it's really helpful to zoom out and hear all those steps, and definitely wish we had more time to do deeper dive into all of those things. And wanting to name, I think it's such a unique offering that your book talks about systemic and structural suggestions for leaders, because I think we need to not just make folks more resilient, but also think about systemic level changes to support folks. But as we wrap up, I'm wondering if a clinician is listening right now to this and they are just deeply in the midst of burnout, what would be the first internal shift you'd invite them to consider?
Yeah, I would just harken back to getting back into that personal agency of what can you focus on, what meaning can you make, and what choice can you make in this moment to move you in the direction of what feels most important to you, and recognizing the limits that are often when you are severely activated and your body is in a mode of self-preservation of hyperarousal or hypoarousal. So I think if you were feeling more wired, agitated, overwhelmed, racing thoughts, then being able to, using your breath, using some physical strategies and grounding to get back into your window of tolerance would be really important. I think if you're feeling more collapsed and heavy and trying to see if you have the capacity to do some very gentle stretching or walking, I think we have to recognize that we are not different than anybody that we're serving. We're people in bodies with nervous systems, with our own lived experience and histories. And I think the most powerful thing that we can do for ourselves this is treat ourselves with the same kindness and compassion that we extend to our clients that we would want for our clients. And I think sometimes that's how I start. I think about, if this was my child, what would I want them to do? If this was my friend or my husband, what would I want them to do? And it's oftentimes with a little bit of that distancing, which I think it's its own sort of compassionate diffusion. It's a lot easier to make a choice
Thank you so much. I could talk to you forever about this, and I'm sure we'll continue conversations, but thank you so much for taking the time today and to talk about your book. And I'm so excited for folks to be able to get it and be able to use it not only with themselves, but hopefully also with folks that they might be working with. So thank you so much.
Thanks, Laurie. I really appreciate you doing this with me.
Absolutely.
Thank you for joining our community on the Affirming Minds podcast. If you loved this episode as much as we did, please follow us wherever you listen to your podcasts and share it on your socials. If you want more information about how this podcast can add to your continuing education credits, visit affirmmentalhealth.com. And remember, let's affirm, heal, and grow together.